Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and you're listening to the 13th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we are going to be interviewing Dr. Cody Lo.
So Dr. Cody Lo received his MD and BSc in Pharmacology from the University of British Columbia and is currently a first-year ophthalmology resident physician at the University of Ottawa Eye Institute. Dr. Lo has an interest in medical education and was the founding member and current resident advisor of the Canadian Ophthalmology Student Interest Group, or COSIG, the Director of Educational and External Affairs for the Council of Canadian Ophthalmology Residents, and is a member of the Canadian Ophthalmologic Society Practice Resource Centre Committee. Dr. Lo is also involved in several research projects related to glaucoma, oculoplastics, and refractive cataract surgery. So without further ado, we're super excited to welcome Dr. Cody Lo.
Thanks for that kind introduction, Emaan and Danielle. I've been a huge fan of Seeing Clearly and eye curriculum, and so it's a real pleasure to be on the podcast today.
Well, trust me, I feel honored that you are a big fan because we are a big fan of you. So thank you for coming and joining us today. I guess we're gonna just go right into it with our first question, which we typically ask all our guests. But could you just talk a little bit about what drew you to the field of ophthalmology?
Yeah, certainly. So when I came into medical school, I had no idea what ophthalmology was. When I came into med school, I thought I wanted to do internal medicine and neurology. And even many of my early experiences in pre-clerkship sort of solidified my interest in those fields. But early on in medical school, I think I got some great advice from various mentors that, even if you find a field that you like, you should still be open-minded and try to explore different fields because you never know what might pique your interest. And so I tried to take that advice to heart. And during pre-clerkship, I tried to get exposure, whether it was through shadowing or just talking to different residents about, what their specialty was like, what they liked about it, things of that nature. And I think it was during my second year that I had the opportunity to shadow, not even people in ophthalmology, but it was actually like neurosurgeons and ENT specialists. And I think it was through those experiences that I started to kind of have this thought in the back of my head that maybe a surgical specialty would be something of interest to me. But it was just kind of this thought in the back of my head. And quite frankly, I didn't have any exposure to ophthalmology. For whatever reason, it was just challenging to really get any exposure to the field. And I didn't really have opportunities to shadow. And so I had this thought, and it really wasn't until the most coincidental encounter where I had this small group session during pre-clerkship. And I was just chatting with one of my preceptors after the session. He was a family physician in Vancouver where I did med school. And he was just offhandedly told me how his son was an ophthalmologist and how he really, found his career very fulfilling. And totally out of just wanting to know about ophthalmology, I just asked if he'd be willing to let me shadow in the OR, purely just because I hadn't seen ophthalmology at all at that point. And I just thought it'd be cool to see what surgery on the eye was like. And so I went to go shadow in the OR and I saw cataract surgery for the first time. And I think it was during that OR that it completely changed my life in the sense that I think it was the first time that I'd seen a surgery that I was really engaged in. I found the detail-oriented nature of it very engaging. The technical aspect of it was very beautiful in my opinion. And so, I instantly had this interest in it. And I remember sitting at the scope with the ophthalmologist who I was shadowing. His name is Dr. Zach. He's a glaucoma specialist. And, I kind of offhandedly said how this is so cool. And it was probably an offhanded comment, to be honest, but he said why don't you consider applying to ophthalmology? And then, at that time, I was kind of end of my second year and I was just I think it's a bit late to be switching gears to something surgical. And I was totally fine just seeing it for the day and just appreciating how cool it was. And he told me something that I'll never forget is that, if you're really interested by something, you should try to pursue it. And, if you end up really liking it and it works out, then that's excellent, but at least you gave it a shot. And I think that was a really offhanded comment for him at the time, but I think it was just that nudge that it gave me to, seriously consider whether this would be a career path that, I could pursue. And so I owe a lot to Dr. Zach. We still keep in touch to this day for really, setting me on this path. And my later years of medical school, then learning more about ophthalmology and realizing that it actually has many of the other aspects that really drew me to the field. I came to realize that I really enjoyed how, we develop longitudinal relationships with our patients for many ocular diseases. I like that it's quite a fast-paced specialty. And so, you help a lot of people in clinic every day. And I think at the end of the day, it made me feel very fulfilled that I feel like I made a difference in a lot of patients' lives that day. And that many of our treatments, I think, are very effective, and I think they produce very meaningful outcomes for patients. And so I think as I learned more about the specialty, it just kind of further solidified that it was something that I could really do as a career, and I feel very fortunate to be in ophthalmology residency now.
Well, thank you so much for sharing all of that. This is always one of my favorite questions to ask our guests, because we've talked about it before in previous episodes, but I find that a lot of the guests kind of stumbled on ophthalmology just like yourself, and then explored the field further and really found it interesting and ended up obviously pursuing ophthalmology. So it's always really cool from a medical student perspective to see how it started with just that one simple interaction and then kind of snowballed into what your career is today. So thank you again for that.
One thing I'd like to add about that too is, I enjoy telling this story because I think it really highlights, just as a medical student, I think it's really important to have an open mind as well. Sure. And to keep your options open in terms of what might be interesting to you, because you may be surprised in terst of what really piques your interest.
Right. Yeah, for sure. And I guess especially now that pre-clerkship is primarily online and virtual, you never really know what's going to actually pique your interest in person. So really like that point that you made too. Kind of along the lines of virtual school, you navigated the CARMS tour virtually, which is kind of a new way that we're going for CARMS. So do you mind talking a little bit about that process and maybe some tips for students that will be going through the process soon?
Yeah, definitely. I think this is such a timely topic, as it seems like at least some aspects of the virtual CARMS tour are going to be here to stay. And so, I think it's really worth sort of talking about some of the challenges and how, both applicants can try to navigate this, but also as residency programs, I think there's a lot of, thought going into how we can, make sure that this process is equitable and that we're able to give all candidates a fair chance. And so in terms of my virtual tour experience, I think last year was challenging because this was really the first time that a lot of these things had been done. And so I think both on an applicant and program side, there was a lot of sort of trying to navigate how to make all of this fair. And I think the virtual tour does present some challenges. Reflecting back, I think some of the challenges were really, getting to know the different programs, because as many of your listeners may know, before you had opportunities to actually travel to different programs during your fourth year electives and actually get to work clinically with the residents and the faculty there before the CARMS interviews happened. And before, CARMS interviews used to be in person. And so in January before, you used to do this, crazy cross-country tour across Canada, actually visiting all the different programs in person. And so I found it really challenging going through getting to know the programs, firstly, just to understand like what they were about, what their facilities were like, what their program offered from an academic standpoint, but also getting to know the resident group. Because, as I'm sure many people can relate to, it's really hard to get a sense of like social interactions and getting to know people over Zoom at times. And so I think all those aspects were challenging. I think some tips that I had for things that I found to be helpful was, I think I was really surprised going through the CARMS tour, how similar many of the programs can seem when you're going to Zoom info session after Zoom info session before the interviews and even during the interviews. And so I found it really helpful that to keep running notes about all the different programs. And so I found it really helpful each time I went to an info session or after an interview to just jot down notes of things that really stuck out to me, or that ways that I felt are related to the program. And I think in particular, like sort of before I was writing my CARMS applications, I had started this process. And it was really helpful, come January when I was actually writing my personal statements and things like that, I could go back to those notes that I wrote. Because it's hard to kind of remember back this info session you went to a month ago, and that program is kind of similar to the other program, and you were just sitting in your room, all these info sessions. And so you don't have those same cues to remember, what stuck out to you about each program. And so I found that to be really helpful to have just sort of your running thoughts about, what interests you about each program. And I even continued that during the interviews too. I think after each interview, you kind of get a vibe from the program in terms of, they often have Zoom socials the night before, and people you're related to in terms of the resident group, and even just a vibe you got from the staff when you're interviewing. because as much as they're interviewing you and asking you questions, like you get a chance to interact with them as well. And so it was really helpful to kind of, as I was going through, to write notes about, how I felt after that interview, and things like that, because at the end of the tour, you're drained, you've done, however many Zoom interviews. And when you ultimately have to make your rank list, I think it was really helpful to be able to go back now after that everything's done and to really reflect on, how you felt after each interview. And I feel like your memory is always the best, like right after, the interview or whatever it is, than a couple of weeks later when you're trying to think back. I think the other thing about the virtual CARMS tour too is because you have very limited exposure, not being able to go to these programs in person. I would say definitely keep an open mind when you're going through the CARMS tour. By the nature of you doing all of your electives sort of at your home program, you're going to know that program the best, most likely, and you're going to probably know the residents at your home program and things like that. But I would try to be open-minded. All the programs across Canada, particularly in ophthalmology, are excellent. All of them have great faculty and great residents, and you're going to get great training everywhere. Mm-hmm. And so I think it's important to be open-minded. Even if it's part of the country you've never lived in before and never been to, I think it's important to try to be open-minded when you're going through the virtual CARMS tour, even if it can be challenging that you don't get to have that face-to-face interaction. And so another tip that I had during the virtual CARMS tour is I think it can be quite draining going through interview after interview. And so I think a helpful thing for me was also having a strong support network. And so for me, I had a number of, friends from medical school who obviously were also going through the CARMS match. And I think it was helpful to have people that were going through the same experience as you and being able to bounce off, ways of practicing for interviews and writing personal statements and things of that nature. And having like family and friends, and have a really supportive partner who, I'm able to talk to if I didn't have a good interview or, things didn't work out in terms of my personal statements or letters that I would have liked. And so having that support network, I think, is really important, especially when you're doing CARMS virtually and you're kind of just stuck in your room, in your house for large periods of the time.
Oh, yeah, that's all incredible advice. And I know this is completely different, but even having been navigating Zoom medical school online, like, first of all, the Zoom fatigue is real, but also you might be sitting in your room, you listen to a lecture, you listen to something, and you think you're going to remember it right away. But then, like you said, you don't have those same cues because you've been stagnant in the same place constantly. So it's important to just do those small things like taking the notes and reminding yourself and relying on the people around you. That's all incredible and valuable advice that I think people just don't even think about, or don't even take the time to go to their way to do so because they feel so lost in the program. So thank you so much for sharing all of that. I guess now that you are a resident and have already navigated this virtual CARMS, I just want to ask you a little bit about how your PGY 1 year has been going so far. And if you could talk a bit about what the life of an off-service resident has been in this first year.
Yeah, for sure. And so I'm actually almost exactly halfway through R1. It's pretty incredible how fast the year has gone by. And so, I think part of something that was unique for this year is that I think a lot of people who matched at programs away from their home institution were kind of really very much venturing into a program that they've maybe only met virtually. And so here in Ottawa, I think it was really great that we start PGY 1 with a month in the eye institute in the emergency eye clinic, which I think was a great way for myself, who didn't do med school in Ottawa, to get exposure and meet the other residents. And you really feel part of the department really quickly because you get to work sort of in your field and get to meet all the support staff, the technicians and things like that. So that was a really great start to R1. And as many of your listeners may know, most, if not all, programs in Canada in ophthalmology do what's called an off-service year. And so, the large majority of your first year is off-service, meaning you're doing specialties other than ophthalmology. And so, many programs do a combination of internal medicine, plastic surgery, ENT, things like that, with the hope that it really helps you sort of build your foundational knowledge in medicine. And also maybe you pick up some skills and some knowledge that eventually will help you as you move into your core ophthalmology years of training. And so, I think some of the benefits of R1 is that I think it's a really great opportunity for you to learn without necessarily the expectation of knowing a lot of information. People know that you're an ophthalmology resident. And so you're really just here to learn and sort of take in the experience of being a resident and trying to learn whatever that specialty has to offer. And so in that sense, it's a really nice opportunity to just not have the pressure of feeling like you need to perform and impress every single day, and that you're really there as a learner. And also just trying to learn how to be a resident too, because I think that transition into residency, having to sign your own orders, do call, have a bit more responsibility, I think can be a bit daunting. And so, it's helpful to kind of have that transition in a really well-supported environment. So I think those aspects of R1 have been really good. And I think also it's really nice because in many ophthalmology departments, you're sort of in a different building or on a different floor of the hospital, and you're kind of separated from the rest of the other services in the hospital. And so, coming to a different institution, it's really nice during your off-service year that you get to meet a lot of the other residents and staff in other departments. And so now being sort of halfway through R1, you've kind of hit your stride where, when you walk through the hospital, you see like other residents that you've met in other capacities and other services. And, when you're consulting other services, you talk to the staff that you worked with a couple months ago on a different service. And so I think it's really helpful just kind of being able to build your network and meet people in person. I think building those relationships is really helpful as you kind of move into your later years, because when you're calling someone on the phone for a consult, it's a lot nicer when you've met the person before. And I think it helps you get your work done in a much more enjoyable and productive way.
Well, thanks for sharing that and kind of explaining what an off-service resident is, because I feel like we're not really told as medical students that much about the differences between the PGY 1 to 5 years, depending on the program. So it's really nice to hear that and kind of hear what your day-to-day has been like for the past 6 months, but also what a lot of other PGY 1's day-to-day will be like. So from a medical student perspective, that was extremely helpful. So thank you very much. So kind of along the lines of off-service residents and off-service electives, do you have any advice for students, I guess, that are not on ophthalmology specific electives? How would you recommend for them to learn more about ophthalmology when they're doing those electives that aren't ophthalmology specific, or even through extracurricular activities?
Yeah, no, this is a great question. Because I think unfortunately for students that are interested in ophthalmology, opportunities to get exposure to ophthalmology can be quite limited. That was my experience when I was a second year med student, not even knowing what ophthalmology was. Right. And I think even once I wanted to pursue ophthalmology, I still, felt those challenges of trying to get exposure and trying to get good on a slit lamp and figure out all those sort of basic skills to figure out if that's a career choice that you want to make. And so some tips that I have is that, I think it's definitely helpful as you go through medical school to find opportunities to develop that interest in ophthalmology. And so, for example, I think once you move into your clinical years, it can be helpful to express that you have an interest in ophthalmology as you move through your different clinical rotations, because oftentimes there are a lot of fields that have overlaps. Mm-hmm. And I think this is actually something, as I reflect back on medical school, I kind of wish I did a bit more. Because I remember as a medical student, I thought that, maybe attendings and residents would kind of write me off and not want to teach me things if I said I was interested in ophthalmology, because I know we kind of have this stereotype of not needing to know anything you learned in medical school and things like that. And I was keen to learn medicine. Like I just wanted to be like a good physician as sort of a baseline. But, now going through medical school, now being a resident, like teaching medical students and things like that, I think people that are keen to teach want to teach you something that is aligned with your interests. And so I think as a resident, like I want to know if my med student is, not necessarily interested in my field, but maybe interested in something else. And, how can I teach them something that is going to be relevant to their interests? And so, thinking back, I kind of almost wish I did that more. It's kind of a fine line to walk because, I think even if you have this interest, I still think regardless of what rotation you're on, there's still a lot you can take, even if it's not necessarily related to your specialty of interest. Even just from the simple fact of, in ophthalmology, for example, we're seeing patients that are seen by all different types of services. And so it's helpful to just kind of understand, what those specialties think about, what sort of their bread and butter, what kind of treatments do they do, how do they make their decision-making around treatment and things like that. And so it's kind of walking this line between, having a keen interest and wanting to pursue that, but also being keen just to learn in general. And so, a story from medical school that I have around this is that I did a rural family practice rotation in the small community in northern BC. And when I went there, I kind of mentioned to some of the preceptors there that I was interested in ophthalmology, but I was kind of flexible and open to really learn anything. And I'm really glad that I expressed that, because they had a local ophthalmologist there. And because the rotation was quite flexible, they, very willingly set me up with that community ophthalmologist in my third year before my fourth year electives. And, that ophthalmologist, because there's no other trainees in this rural community, was very kind and let me, work up a ton of patients. I think I probably made my biggest gains in terms of slit lamp skills, during that month that I did. And many of the emerge docs in the community knew I was interested and would call me, actually call me on my phone, during the middle of the day to walk over to the emerge, because it's a small town, and see an eye case that comes in, whether it be a corneal abrasion, because it was a very industrial town. And which I think just highlights that, I think if you just have a good attitude and, you're keen to learn and you're a pleasure to teach, I think is a huge thing. But you just so happen to have this interest in ophthalmology, I think, you can bring a lot of good opportunities to yourself in that way. And so it's definitely something that I would recommend to students to try to seek out those opportunities and capitalize on them. In terms of specific rotations or electives that I think are really relevant, I had a great time on my plastic surgery rotation this a couple months ago as an offservice resident, just because our colleagues in plastic and reconstructive surgery, I think, are so good at achieving good cosmetic results for patients and minimizing tissue trauma to tissue. And I think that's such an important thing in ophthalmology, because the tissues that we deal with are so delicate. I think a lot of the principles, even though they're working on different body parts, their incisions are a lot larger than ours. But I think their way of thinking is something that can be applied to ophthalmology. So I really enjoyed that one. I think neurology, I'm a little bit biased because I had an interest in neurology before, but I really do think the eyes are in a way an extension of the brain. And so I've really enjoyed that as well. And surprisingly, I think that rheumatology has a lot of overlaps as well. The eye is a very vascularly rich tissue. Many of the pathologies that we deal with are related to inflammation in some capacity. And so, working with the rheumatologists, seeing the variety of ways that inflammation manifests in the body and the biologics that they use and things like that, I found to be really helpful, because oftentimes as ophthalmologists, we're seeing first presentations of rheumatological disease in the form of uveitis. And so I really enjoyed that as well. And so I think there's a number of rotations. I think even if you just went on your home programs, ophthalmology residency programs, curriculum schedule for their off-service year, you'll see a list of the specialties that at least that program thinks is relevant for an ophthalmologist to know. Mm-hmm. And I think finally, in terms of extracurriculars, as a med student, I really felt sort of the pinch of, especially because my fourth year was virtual, trying to get opportunities to be involved in ophthalmology. Obviously, iCurriculum is a great resource, but I guess your listeners already know that. And also COSIG, an organization that I was involved in, now as a resident advisor, I'm really proud of all the initiatives that we've been able to start over there as well, in terms of helping get students involved in ophthalmology. And I think generally, ophthalmology residents are really passionate about the field that they're in. And so I know when I was going through as a med student, I think many ophthalmology residents are very keen to, help medical students and talk about, why they love their specialty so much. And I think now, because, meeting virtually is sort of the norm of things now, I think there's really been huge opportunities that I think it's, very normal to reach out to people from different programs and meet virtually. And so I think in some ways, those opportunities to meet with residents from, other institutions or, people you may not have interacted with previously when there's a large focus on in-person learning, I think there's some real opportunities there for med students to sort of expand their horizons.
That was incredibly valuable advice. So I just want to thank you. That was incredibly unique advice that I think it really resonated with me, and I'm sure Emaan as well, and I'm sure our listeners too. But I think it also just gave me a new way of thinking about the electives and all the different specialties. Yeah, you might not be working with the eyes or the exact organ that, of the specialty that you want to go into, but the small details that can connect from one specialty to another, that's very valuable and incredible. So thank you for sharing that.
An anecdote that I can add there is, here in Ottawa, we do an off-service rotation in ICU, which I know during the early stages of COVID, Dr. Glaucomflecken made a ton of jokes about, the ophthalmologist having to be in the ICU.
Right.
And so as a junior resident, you really live out that joke, really. And despite it being one of the most scary rotations of my entire life, there was actually eye presentations that came through the ICU.
Right.
And my shining moment on ICU was when someone came in with bilateral retinal detachments because of hypertensive emergency, and I got to do fundoscopy during ICU rounds. And so I think that just goes to show, even the most unrelated fields of medicine, can have relationships to the eye. And so I think it's, really helpful to just kind of keep your mind open, and especially as a trainee, you have, these incredible opportunities to work with people from all different fields, and, oftentimes very low stakes. And so I think those are really valuable opportunities to see some things in medicine that you may never see, once you become too specialized in residency.
No, that's 100% true. And trust me, I've seen those TikToks and I was laughing and I was like, I don't know what an ophthalmologist would necessarily do in the ICU, but that's great to know. And clearly they put you on these off-service rotations for a reason. So yeah. With all that being said, that actually wraps up our, ophthalmology school focus section of the podcast, which allows us to finish with maybe our favorite section, although I love the first section too, but this one keeps it fun and interesting, our would you rathers. So I'm going to start and then Emaan will ask one question after. But my first question to you is, would you rather have to sew all your clothes or grow all your own food?
Ooh, that's a good one. I'm notoriously bad at spending time cooking. I'm one of those people that, love just meal prepping for the week and not have to think about it during the week. And if there was a way to eat well, just through an IV or something like that, I would totally hop on that. And so the idea of having to grow my own food sounds terrible. And so I think I would just, dedicate, time to sew a couple of pairs of scrubs, and that would just be my rotation for life. And I could still enjoy going to the grocery store and doing my meal prep.
No, that's totally fair. The scrubs thing definitely keeps it easy.
Yeah, and at the same time, you're kind of practicing your stitching, I guess. So there you go.
Exactly. Yeah, I'll use some 10-0 sutures to suture those scrubs.
Little practice. So for the next question, maybe a little bit easier. Would you rather be fluent in all languages or be a master of every musical instrument?
Ooh, that's a really good one. It's tough for me because those are two things that I wish I did better. And so it's really hard for me to choose. I think ultimately, I think I would love to be fluent in all different languages, just because I really think it expands your horizons to be able to interact with all different types of people. I think in medicine, it certainly helps a lot. I really wish that, our patients who come in who don't speak English, I really wish I was able to communicate with them in their native language and be able to speak with them at sort of their native fluency. Just because I think it really enhances the quality of care you're able to live. But also for somewhat personal and selfish reasons, being able to travel anywhere in the world and be able to be like a local and find all the good restaurants and things like that, I think would be amazing. So I think it would have to be languages for that one.
Yeah, I think I would agree on that end.
Yeah, it's also, I feel like you really can enrich yourself in a different culture when you speak a different language. So I agree. Well, thank you for answering those questions. And thank you so much for joining us today. It was a pleasure getting to know you. And I'm sure our listeners are going to really value all the advice that you've given. So everyone else, thank you so much for listening to this episode of Seeing Clearly. This is our pre-clerkship guide to all things ophthalmology. And for everyone to stay caught up with everything relating to iCurriculum, you can check out our website, which is www.icurriculum.com, and follow us on Instagram at iCurriculum. Thank you guys so much. Thank you, Cody.
Thanks for having me.
Cody.